Welcome back. Now to our In Focus discussion tonight. Now that a sizable portion of Utahns are vaccinated, people want to get back to normal. But with the people who are vaccinated, what more can they do? What proof of vaccination is there allowance for? One concept being discussed is what's called a vaccine passport, which is basically some kind of proof of vaccination that could allow for gatherings at, say, concerts, sporting events, even international travel. But there are drawbacks to this concept as well, and that is what we are going to dig into tonight. Joining us now in studio are Leslie Francis, Distinguished Professor of Law and Philosophy, and James Tabery, Associate Professor in the Department of Philosophy, both at the University of Utah. Leslie and Jim, great to have you with us. Very interesting concept to dig into tonight. Jim, let's get started with you. What's the rationale behind creating vaccine passports?
Glenn, you know, public health is motivated by a number of principles. One of those principles is called least infringement, where the idea is that when protective measures are implemented to protect public health, they should be done in a way that are minimally restrictive on people's individual liberty. Over the last year, we've all been living with significant restrictions on our individual liberty, right? Think about mask mandates, social distancing, limitations on gatherings. There's good scientific evidence that suggests people who've been vaccinated are less likely to get sick, they're less likely to go to the hospital, they're less likely to die. And so the principle of least infringement would say we should be easing some of the restrictions that are placed on people that have been vaccinated because they are in this safer category now.
I want to get your thoughts on why the name vaccine passport. Is that the most appropriate?
I think it's actually a bit misleading, because it suggests that the domain we're talking about are things like crossing international borders. And as your opening segment suggested, that is a part of the discussion, but we are really talking about a much broader scope here. We could be talking about going to a restaurant, we could be talking about attending a concert, going to a sporting event, and so it's really about, sort of movement in general. And I think the passport concept would suggest we're talking about just something like international travel, which constrains the way that it's actually being talked about implemented.
When it could be actually something right across the street. Leslie, have these vaccine passports been deployed anywhere already, or are there plans in place to deploy them anytime soon?
Well, you heard the earlier discussion about Europe on the news segment that you broadcast. Israel has been using them, I understand, and there have been some suggestions that they might be used in the United States. I want to emphasize the difference between requiring vaccination to go somewhere and how we're going to verify it, which is the passport question. And whether you can require vaccination or limit people entering, say, a bar to those who've been vaccinated is different from the question of whether the best way to do it is by some of the kinds of proposals that we've seen out there.
Mm-hmm. Jim, this has become a very controversial issue and in many ways, unfortunately, politically charged. I want to get into this. Are there things that have been deployed that are similar to vaccine passports that actually predate COVID-19 and the pandemic?
Yeah, absolutely. Many countries require being vaccinated against yellow fever if you are to travel there. That's a genuine vaccine passport. Anybody in Utah who has children that go to school know that the children need to be vaccinated against things like measles, mumps, and rubella before they enter school. That's a kind of vaccine passport. For the last year, we've all been walking around with masks on our face, right? That's a kind of mask passport. All these things in one way or another about protecting the public health, protecting individuals and the public health from a deadly infectious disease.
Talk about what this vaccine passport would actually look like, Leslie. What information would be on it? What would it contain? And how would that work?
So let me go back to a vaccine mandate for one question. So when we talk about public health measures like the requirement that your children be vaccinated before they go to school, those requirements come with some exceptions. There are some people who, for medical reasons, cannot be vaccinated. There are some people who, for religious reasons, would prefer to refuse to be vaccinated. So an initial question actually is whether what we should have is a requirement that you don't come in unless you're vaccinated, or a requirement that you meet a vaccination requirement or have a legitimate reason for not being vaccinated.
Well, they're also offering exemptions for this vaccine as well. We've already seen some school districts here in the state of Utah deploy that, and some are concerned that maybe people are taking advantage of that and not being honest about it.
Well, that's, of course, a very serious problem, that if the reason for requiring vaccines is to protect us all from one another, which is exactly the requirement and a very good requirement, as long as we have enough people who get vaccinated, so we have what's called herd immunity, we have reached what we need for public health. The more transmissible a disease is, and of course some of the variants of COVID are particularly highly transmissible, the more we need to be concerned about having a higher level. We can tolerate maybe 3%, 2%. We can't tolerate people cheating. But what that means is that when we have you provide verification of your meeting a vaccine requirement to do something like go to school or go to a university, that's going to have information that either potentially reveals something about your health, or that's couched in such a way that just says you've met the requirement, rather than necessarily saying you've actually had the jab.
All right, we're going to dig into that in a little bit more in just a sec, but before we head to break, Jim, talk about the timing right now. We mentioned this is highly controversial, but what is it that people are thinking about as we speak that is really bringing this conversation about?
Yeah. A pandemic is an evolving phenomenon, and as it evolves, the ethical, the legal, the social issues evolve with it. A couple months ago, we were talking about prioritization for vaccines, who was going to get them, where you were in line. Hopefully a couple months from now, we're going to be talking about what Professor Francis just said, which is herd immunity. How do we think about that? Is it at the state level? Is it at the county level? What happens when you move from a place that had it, that doesn't have it? But right now, we're sort of in this liminal space between those 2 points. It's a transitional phase where we've got some people who are vaccinated and some people who aren't. And that's where this concept of vaccine passport comes in. It's how do we navigate this transitional phase in a way that does good to both people who are vaccinated and people who aren't vaccinated.
Okay, much more to come on this conversation. We're going to take a quick break, but when we get back, we're going to be talking about the challenges of implementing a vaccine passport. Stay with us. Thanks for staying with us for our second In Focus discussion tonight on vaccine passports. We continue our conversation with Leslie Francis and James Tabery. Let's shift gears now and talk about the scientific and technical challenges of creating and implementing a vaccine passport system. Leslie, we'll start with you on this one. First, how do you authenticate a passport like this? And obviously, it's going to bring up potential for fraud.
Yes, it is, and for security breaches too. So there are two ways to do an authenticated identity. One is a government-issued ID, a passport, a driver's license, or an identity card with a chip in it. You can't forge that. That's what we use if we're going to go in and buy an alcoholic beverage, or if we're going to go to a state liquor store, and everybody's got to show it. The other way to do it that's being talked about is an app on your smartphone. And those raise privacy questions, they raise data security questions, and fraud questions. I worry about hacking.
Yeah, they also raise access questions, which we'll get to a little bit later.
Yep.
Jim, the United States right now does not have a central system for tracking this. So how would it even be managed and maintained?
probably what we're going to see is a sort of patchwork system, Glenn. You know, looking across the playing field now, you've got New York with its Excelsior Pass. Utahns who have passed through Salt Lake City Airport will notice when they're waiting in security the company Clear. Clear has its own device called Health Pass, which they're planning to expand to COVID-19 vaccination. In the opening segment, you talked about the EU and the Green Pass. The World Economic Forum is talking about something called a Common Pass. So I think the most likely outcome is what we're going to have is a sort of strange patchwork where there's all sorts of different passports out there. And one of the real logistical challenges is whether or not those are going to be interoperable, whether or not you can move from one system to the next, you know, with your Excelsior in New York and see it respected somewhere else.
Okay. These vaccines, they happen very quickly, not the normal process. So the fact that they're under an emergency use authorization, Leslie, is that relevant to this conversation?
Yes, it is, because if some kind of drug or some kind of vaccine is only authorized by an EUA, the person administering it to you can't require you to take it. Now, some have interpreted that to mean that as long as it's under an EUA, they're not going to require people, they've got legal concerns about requiring people to be vaccinated. The recent bill that passed the legislature and was signed by the governor here in Utah prohibits any state entity or government entity from requiring vaccination as long as it's under an EUA. Now, the University of California system is going to require vaccination, but their requirement also is limited to only after vaccines are no longer under an emergency use authorization.
We're going to dig into that a little more with you, Leslie, in just a second. But first, Jim, the latest studies have shown that the immunization is good for up to 6 months. So now there's talk of, is this going to be an annual thing? There's talk of boosters. We, of course, know the different strains of the virus and variants. So how do you track all that and keep that up with this vaccine passport?
It's going to be a real challenge, Glenn, right? As you said, there's lots of just basic public health epidemiological questions that remain unanswered. If you've been vaccinated, are you protected against these new strains? Do we need a booster shot? Do different vaccines prove to be more or less effective to the different strains as they come along? When we shift from that just basic epidemiological question to trying to implement a passport system, really what a passport is designed to do is say, this person is up to date, right? But the challenge is what counts as up to date is going to evolve over time, and that's going to be based on the science. So, you know, when these things expire, when they sunset, when you need to get re-upped, that's all going to have to follow the science, which makes any system that tries to track who's up to date very, very challenging.
Okay, Leslie, back to another point you just made. You already mentioned the bill here in Utah, limiting what can happen in a government facility, but we've already seen a couple of states with executive orders ban a vaccine passport all out. So how do you balance this line between what states are going to do and what the federal government might do?
So legally, the power to protect the public health belongs to the states. So the federal government, if it were going to implement something, would have to have a federal power like the Commerce Clause power. Of course, international borders are for the federal government. So I think we're going to see most of the activity with respect to this at the state level, not at the federal level.
So what we will ultimately see is one state choosing to go one way and another choosing to go the other way, potentially.
Yes, but that brings up, I'd really like to go back to the point that Professor Tabery made right at the beginning. What's the most effective way of protecting the public health? Is it to do something controversial like a vaccine passport, or is it to just encourage everybody to get vaccinated as quickly as we can so that we end up with herd immunity, which reduces the spread
Okay, we've got to take another quick break, but when we get back, we're going to talk about the legal and ethical concerns of vaccine passports. Stay with us. All right, welcome to our third and final In Focus discussion tonight on vaccine passports. We continue talking with Leslie Francis and James Tabery about this issue. Let's talk now about the ethical and legal concerns of a vaccine passport. Leslie, start with you. We typically think of personal health information as being a private matter. In fact, there are laws ensuring so. HIPAA would be an example. So aren't these concerns about privacy with vaccine passports a potential problem?
Yes, they are. And HIPAA covers the information that's in your health record as it's held by your healthcare provider. It doesn't cover information in an app that isn't a healthcare provider or insurance company.
So where does the problem for privacy potentially come in?
Because we don't even know how companies creating apps are going to use that information.
Got it. Jim, the COVID-19 pandemic has raised many concerns about racial health disparities here in the United States, even here in Utah. And those concerns have also included inequities in ability to access a vaccine. So what about the possibility of a system of vaccine passports that could potentially just make that problem even worse?
That's exactly right. I think of all the concerns that have been raised about these vaccine passports, the equity concern is the most troublesome. As you said, across the United States, here in Utah, communities of color have been hit the hardest by the pandemic in terms of death, economic upheaval, sickness. It's also extended to accessing the vaccines, right? We see disparities among communities of color in being able to access the vaccine. So there's a real concern here that vaccine passports will, as you say, exacerbate this problem. They're going to feed off that disparity in being able to access the vaccine and essentially privilege the people who have been able to access it, which just compounds the problem.
Mm-hmm. Leslie, you already brought up the point of it being digital and the privacy concerns there, but there's another issue with that, and that could really hit disadvantaged people as well because they don't have access to, say, the internet or a smartphone.
That's exactly right.
So where do we go when you take a look at that? Where do you balance that then?
Well, my argument would be that what we should do is we should do everything we can to get herd immunity. If we do need to have proof of vaccination, we should do it in the way we do it for schools, in the way we do it for proof of age when you have to show your identity card to buy a drink. We should do it in a regularized way that everybody can use.
So your argument is that digital isn't the way to go here?
Correct.
Got it. Jim, there are many people who can't get vaccinated. We've kind of hit on this as well for health reasons. People with certain autoimmune disorders. Doesn't a vaccine passport system also then discriminate against them?
It certainly poses that risk, right? I think we want to be careful not to perpetuate the idea that anybody who's not vaccinated is worried that Bill Gates is trying to sneak a microchip into their arm. Lots of people can't get vaccinated right now because it remains to be seen whether or not they can get safely vaccinated. It could be pregnant women, it could be people, as you said, with an autoimmune disorder. And so any legitimate, any ethical vaccine passport system is going to have to incorporate some element of what we might call qualified exemptions, where accommodations can be put in place for the people who can't get the vaccine. And so until that's available, this really does risk sort of exacerbating ableism.
Okay, so let's talk about that and dig into that a little bit more. A big conversation, debate being had about this. Jim, what's the actuality that our viewers that are watching right now could actually see this type of vaccine passport system put into place anytime soon?
I think a lot of it's going to depend on the kind of lifestyle that people live. If you are required to travel, if you're looking forward to travel, if you're eager to get over to Europe soon, you're almost certainly going to encounter something like this. On a more limited level, maybe not so much. But I also think it's worth thinking about, are there ways in which we're sort of incorporating individual vaccine passports already, right? If you are doing things or planning to do things after you've been vaccinated, associating with people who've been vaccinated but not people who haven't been vaccinated, there's a way in which you're kind of already implementing an element of this on an individual level.
Okay, yeah, you make a really good point there, because travel is certainly where we hear about it the most at this time. Leslie, your final thoughts. Is this going to happen anytime soon?
My final thoughts are that everybody ought to go out and get vaccinated if you can do it medically, because when you do that, you protect yourself and you also protect others from you. And please wear your mask.
The two of you are 6 feet apart. That's why you're not currently wearing your mask here in the studio, but we sure appreciate you being here. Once again, you've been hearing from Leslie Francis, Distinguished Professor of Law and Philosophy, James Tabery, Associate Professor in the Department of Philosophy, both at the University of Utah. Thanks for joining us tonight.
Good to be with you.
Thank you very much.